Hello, my name is Elsie Garza and I'm a licensed mental health counselor here at CBHA.
Hello, my name is Michelle Taylor. I'm a psychiatric nurse practitioner here at CBHA.
Hi, my name is Dea and I'm a behavioral health consultant here at CBHA. One thing that we have to talk about are the barriers to wellness. Amongst our chats, what are some of the things that you guys think have been those barriers for some of our patients?
I think most of our patients maybe feel some type of fear about coming in, or what the conversations are going to be about, or what we're going to tell them is wrong with them, because there's this huge stigma still about mental health and those types of issues. So I think a lot of people really do refrain from seeking help because they're uncomfortable talking about those things, because they're scared about what it might mean, I think.
I do think that it's normal to feel uncomfortable talking to a stranger, about what are your deepest, darkest things or things that you go through, but that's definitely one of the barriers that I've seen. Like, a lot of patients tell me it's weird or it's strange coming to talk to a stranger about my problems, but at the end of the day, we are there to help them and not stigmatize them or make them feel judged about, why they're there or what we could do to help them.
Yeah, I agree. I think that, just fear of the unknown, of what to expect, is a big, big part of it. People don't understand what it is that is going to be asked of them, or how much they have to give, information they have to give. And honestly, it's just what you're willing to give. That as the relationship develops over time, more and more is shared. So that, the initial coming in is going to be a little scary because you don't know what to expect.
Yeah, I wish patients knew that. I wish they knew that just because it's your first time coming to see me doesn't mean I want to know every single thing about your life.
Yeah.
I think it's okay for us to develop a relationship, for me to build trust, right? To be able to build trust so that you do feel more comfortable sharing and being honest about what's going on. Because it doesn't have to be just one time, conversations. It can be ongoing conversations that we have about some of the issues that they face. And so I do wish people understood that too, that even though there's a little bit of fear, we can approach it with, slowly, we can approach it with caution.
Exactly. So we talk about what's on your mind that day, and then, maybe some things come up from that. You'll discover some new things. That's kind of what counseling is all about.
To explore different things that are going on.
Yeah.
Kind of along with that, I think it's a lot of fear of being labeled, right, with the stigma. So being labeled with, any kind of diagnosis is sometimes scary, but the way that I see it is if you know kind of what you're dealing with it, you know how to cope with it better.
Right.
Exactly.
Having a diagnosis doesn't mean it's some sort of life sentence. It's more about knowing how to take care of what your individual needs are. We can tailor fit plans for you if we know what we're trying to manage or trying to deal with. But without that, it makes it a little bit more difficult to try to get you the support services that you actually could benefit from.
Definitely, you put a name to it so it seems maybe like it has less power over you. Mm-hmm. And if you know that it's, let's say anxiety or depression, now you know where to start, and instead of being kind of all over the place about what's going on, a starting point, and the signs and the symptoms to look out for, and then how your body reacts to that specific thing. So even though it is a scary thing, because there's still a stigma to it, it's a really good starting point to understand yourself a little bit better.
Right. Exactly. One of the other things that I think is a big thing is, having a good social support network. That's another barrier. A lot of people don't have huge support networks here, or a lot of connections, and I think that plays a role into how you approach wellness and how you be well.
Yeah, unfortunately, a lot of our population, they're farm workers, and they come for certain periods of the year, for seasonal work. And so they come, and it's really hard to set up roots, in the area when you're only here for, let's say, 4 or 5 months at a time. And so a lot of them leave their families and they leave their friends and they come for work, and they don't really have that sense of home here. So it's hard for them to really get support if they do face something difficult.
Right.
Who can they trust to talk to?
Yeah.
So unfortunately, a lot of these families, their families are not necessarily here with them. And although they can talk to them over the phone, there's nothing like having, that social support that's there.
That personal connection.
Right.
Yeah.
Along with that goes like the limited resources in our area, right? So not having a whole lot of opportunities to engage in those kind of events or social opportunities where we would be able to make those connections and get those friendships or establish those relationships.
Yeah, so you kind of have to try harder to find those things. It's not as easy as it could be in a bigger city where there's more going on.
You really have to put yourself out there.
Yeah, you
and
really
that's
do.
a scary thing to do if you know you're new to the area and don't have a lot of people here. It's hard to put yourself out there.
Yeah.
Another barrier that I think we've experienced with our population is just the cost and the finances, that whole part in order just to get help, you know? What do you guys think about that?
Yeah, I agree.
I think a lot of people are scared because they don't know how much it costs. Like they don't know anything about like how to finance the type of services that they may need or what type of coverage they could have or what we're willing to help them with, just because they hear something like at the doctor's office and it's like, oh, a bill, you know, and maybe that's not something that's feasible for their family. So it could deter people that even though they know that their children or their spouse or themselves need help in that way, I think the financial pressure and the financial stressors really get the best of them maybe, and that's what limits them from reaching out.
Right, I agree. I think, you know, prescriptions, when you talk about, you know, medications for anything, you know, prescriptions cost money. And if you don't have insurance, that's money out of your pocket. Even if you do have insurance, a lot of times it's money out of your pocket, you know, and that money could be used for things like food on the table. And so how do you make those choices? You know, that's a big barrier. Yeah, so I think that plays right into, you know, cultural and community kind of views surrounding wellness and the efforts that a community puts into making sure that its members know where to go to find those links to resources to be well. You know, that's another barrier that, you know, we see a lot.
Definitely. I think culturally, especially that kind of got me thinking about how within the Hispanic culture, and obviously there's a lot of different cultures within the area, but primarily being from, you know, the Hispanic culture, a lot of what their view of success is hard work and financial stability. And although that is something that could be seen as success for a lot of people because it is necessary, you know, and to live a happy, stable life, you know, finances do need to be stable. There's also so many other things that go into it, like family health, friendships, like those other types of things that can fulfill you in other ways that money or your work can't necessarily fulfill you. And so if they're so hyper focused on just the financial success, they could be lacking in other areas that can help them feel more fulfilled.
Or neglecting other areas.
Yeah.
Right? So if we're spending all our time at work and not taking time for family, that is a detriment to our family, but it's also a detriment to us as well because we are lacking the social support network.
Right.
And that the reason why we work is to be able to, you know, have the money to have the opportunities, right, for ourselves and our families. And if we're spending all our time at work, then we're not reaping the benefits of our hard work. And that's important to have a work-life balance.
Right.
Definitely, because it gives you time to focus on the other things that you value.
Right.
Because clearly finances and success in that way is a value that we have, but I also value my health. I also value education. I value my family. I value, you know, spirituality. And so how much time am I allotting? If I'm working, you know, 80 plus hours a week, how much time do I have extra to really focus on the other things that I value as a person?
And that are important to being well. All those things are components of being a well person. You know, so we need to focus on them all, make sure they all have equal opportunity, and we take time for everything. And consider everything.
Yeah. What do you guys think could be some community efforts that maybe we together as a community can start doing to support some of our, you know, our patients or some of our residents here in the area?
Now I'm thinking some of the things that we do already, some of the community events like the Color Run, like the, you know,
The health fair.
The health fair, thank you. Some of the things we've done with the schools and things like that. It would be good to, you know, include more of the other community resources, or to partner more with our other community resources in promoting these things as a unified community view.
Definitely.
I think.
Yeah, just work together with different types of resources so that people know that wherever they go, you know, whoever they touch hands with, we have access to resources, you know, for them.
Exactly. Yeah. I agree.
So I really hope that some of our viewers and some of the residents in the area take into consideration some of the things, you know, that we've talked about today. Although there's certain stigmas and there's certain anxieties and there's certain worries or fears about, you know, coming in to get services, we are willing and ready to help in any way that we can. And, you know, with any type of question or education that they feel like they may need, like, I think it's important to just reach out.
Exactly. So if anybody has any questions about anything we talked about, feel free to reach out to us.